Welcome. I'm Jim Minow, Executive Director of the CureJM Foundation, and honored to be your host of this Rare Disease Day session at NIH. Our objective today is to share with you the story of how one small rare disease organization that funds research to find better treatments and a cure has had an outsized impact, in part through creating effective partnerships with leading research hospitals and most notably with NIH. I'm going to start with a 1-minute background of who we are and how we evolved to where we are today. CureJM was created by a small group of volunteer parents and grandparents in 2003 to address the fact that very little was understood about juvenile myositis, a devastating pediatric autoimmune disease where the body's immune system attacks its own cells and tissues. CureJM's mission then, as now, was to find better treatments and a cure for JM and support families living with juvenile myositis. Where does one even start when you are at virtual ground zero? Well, we knew we had to accomplish 3 objectives if we were to be successful. First, we had to recruit other families and involve them in CureJM's work because there is strength in numbers and having each other for support. Second, we had to bring whatever medical and research experts we could find inside our tent. In 2003, there were only very few of them, but we were fortunate in our early years to find 2 of them, Dr. Lauren Pachman at the Lurie Children's Hospital in Chicago, and Dr. Lisa Ryder with Dr. Fred Miller right here at the NIH. And third, we knew we needed to create lasting, sustainable partnerships with institutions like the NIH to leverage the enormous research capacity that they have. What we didn't know, at least at the time, was the extraordinary personal and professional commitment NIH researchers and clinicians would bring to our rare disease cause. Which brings us to our first presenter, Dr. Lisa Ryder. Dr. Ryder is head of the Environmental Autoimmunity Group at the National Institute of Environmental Health Sciences at NIH in Bethesda, Maryland. Dr. Ryder was an early pioneer in myositis research and is one of the world's foremost myositis experts. Many of our families, and this is no exaggeration, credit Dr. Ryder with saving the lives of their children. Here to share with you her perspective on the CureJM NIH partnership is Dr. Lisa Ryder.
Thank you, Jim, for that very warm introduction, and it's a great pleasure to join with you today in this NIH Rare Disease Day session. To review, our Environmental Autoimmunity Group has focused on understanding the role of environment and genes, disease mechanisms, and the assessment and treatment of myositis and other systemic autoimmune diseases, both in adults and children. Our goal has been to develop targeted therapies that would be directed to pathomechanisms of disease phenotypes with a promise of inhibiting the effects of these different environmental factors. And we've done a number of studies here at the NIH Clinical Center in Bethesda, including several natural history studies that have examined the role of environmental and genetic factors on autoimmune disease, particularly on myositis, as well as several treatment studies, including that of rituximab in myositis, a new biologic therapy, and our currently enrolling study of IV sodium thiosulfate for the treatment of calcinosis associated with juvenile and adult dermatomyositis. I think it's no wonder through the partnership with CureJM that more than half the patients enrolled in our studies have actually been patients with juvenile myositis, thanks to their referrals. Really, this partnership with CureJM has been instrumental in expanding our focus on juvenile myositis research, both within EAG and at the NIH. First, CureJM has partially supported the training and or research of several different fellows, including starting with Gulnara Mamarova, who is now a research associate at George Washington University in a myositis center there. Hannah Kim, whose work on proteomics and biomarker research was supported through her work in NIAMS. and Takayuki Kishi, a pediatric rheumatologist from Japan, as well as Sarah Sabag, a research fellow with me, who is now at Medical College of Wisconsin. And many of these trainees are focused now on juvenile myositis research and clinical care. CureJM also funded several key collaborations in our work, including the support for an international myositis genetics consortium. It was CureJM that provided key funding for the support of studies of GWAS and exome chip in patients with juvenile dermatomyositis, which led to the identification of unique HLA risk factors for this disease, as well as several other genetic risk factors. CureJM also has more recently funded the postdoctoral research fellowship of Travis Kinder in Jim Inglase's lab within NCATS. That group has gone on to develop assays to assess the molecular hallmarks of myositis in the test tube, and then screen large numbers of approved drugs and investigational agents with the hope of identifying new drugs that may help JM patients. And then CureJM also was a key partner in our International Myositis Assessment and Clinical Studies group, particularly in the development of new response criteria for adult and juvenile myositis. IMAX is an international multidisciplinary consortium that uses global approaches to improve treatments and understanding of myositis. And CureJM was key in funding a portion of the analyses and even the consensus conference to develop these new response criteria. And out of that work, the ACR-EULAR response criteria were developed and are now used as the primary endpoint for myositis clinical trials, leading to the expansion of new therapies being studied in myositis and developed. And this work really came to be recognized by Global Genes through a Rare Champion of Hope Award for research collaboration, which Fred Miller and I were very fortunate to receive in the presence of Sherry Hume, one of the founders of CureJM. CureJM has also partnered with forming the GW Myositis Center, a center where Hannah Kim and I and OJ Jones attend in the clinic with Rodolfo Curiel, an adult rheumatologist, to consult on patients with juvenile myositis. This is a close collaboration between George Washington University, NIH, and CureJM. And we're also performing joint research studies as well, including an abatacept clinical trial, which is developing a new biologic therapy for juvenile myositis patients. We've also educated a large number of adult and pediatric rheumatology trainees in the clinic, fellows, residents, medical students, and even visiting faculty. And these all have been able to provide excellent clinical care going forward for patients with juvenile myositis. We're particularly, our work is really summarized in the proclamation of thanks that Jim Minow delivered to us at the last NIH Rare Disease Day, really giving his thanks to the NCATS, NIAMS, and our group in NIEHS for the work we've done. And really, it was the dedication of this partnership of CureJM with NIH, this proclamation that leads us to keep sight on the importance of finding better treatments and a cure for patients with juvenile myositis and supporting families of those who live with juvenile myositis. And that really, this partnership has been very key to this work. So thank you, Jim.
Thank you, Dr. Ryder. I'll return with a question or two for Dr. Ryder, and we'll have a chance for the audience questions as well. If you have a question for Dr. Ryder, please post it in the event app's Q&A now. Earlier, I mentioned the importance of involving families in everything we do as a nonprofit, especially research. Our next guests are Kristine Alderfer, a 12-year volunteer with CureJM, and her daughter, Katherine, who was diagnosed with juvenile myositis at the age of 4 and remains in treatment today. Kristine has taken the lead on many volunteer-driven initiatives over the years and has most recently been elected as president of the CureJM Board of Directors. Kristine, I'll start with you. From a parent's perspective, why are research partnerships with institutions like the NIH so important to you?
Thank you, Jim. In my view, rare disease organizations really need to focus on the discovery of better treatments. I don't need to tell any of you at this session that most rare diseases don't have approved treatments. To cure JM, it made sense to partner with major research institutions and especially with the NIH, perhaps the most preeminent research institution in the world. We were fortunate to find that Dr. Ryder's and Dr. Miller's lab had already been conducting some important basic research into causes of myositis. Dr. Ryder graciously agreed to join our medical advisory board, and over time, with help from our funding, could direct more of her research to juvenile myositis directly. As she said, we were also able to recruit fellows to support JM-specific research projects like the one that Katherine participated in.
And Katherine, you are now 15 and have been living with disease for more than a decade. From a patient's perspective, what does this research and participation in this research mean to you?
Thank you for having me today. In March of 2010, I developed a strange rash. My parents thought it was an allergy to something. My mom changed all of the bedding, soaps, and anything else that would have caused this awful rash. People would stop me in stores and tell my mom that she should use sunscreen on me. I became cranky, tired, irritable, and fatigued. One day, I could walk up the stairs in our house, and the next day, I could not. I started choking on my food. My parents pushed doctors to tell us what was happening to me. It took months and many appointments to make progress. Just days after my 4th birthday, I was diagnosed with juvenile dermatomyositis. My parents had never heard of this disease and did a quick Google search, which showed us how terrible this diagnosis was. Next, we received a call from Riley Hospital for Children in Indianapolis, and my parents immediately packed a bag and headed for the ER. From this day forward, our lives would never be the same. I was diagnosed with this rare 2 out of a million disease, a disease for which there is no cure, a disease in which the body attacks itself. When your muscles are attacked, the damage is permanent. My muscles were being destroyed, and I was failing more every day. I was admitted immediately and started on treatments to help. They started me on massive doses of steroids and chemotherapy. I was only 4, and I was miserable. It was the beginning of 12 years of many infusion treatments, hospital stays, oral meds, and trying to figure things out. Luckily, my mom found Dr. Ryder through the Cure JM Foundation, and she helped to figure out a treatment protocol that would help me. My twin sister and I have both participated in studies at the NIH, and I have been seen at their clinics several times. I'm thankful for this and so glad that Cure JM supports research in those clinics. Participating in research studies is something patients have to do if we are ever going to find a cure for all rare diseases. Some kids with JM get better faster because there are existing treatments that work better for them than others. I have to believe that NIH research will lead to better treatments. That's one reason I'm involved in the research. Dr. Ryder and others can't do their work without us. When we take part in research, we are building our own future. It's very empowering.
And Katherine, how did it feel when you would go to NIH and participate in one of Dr. Ryder's or the other doctor's research studies?
I really felt like someone was looking out for me. Juvenile myositis can be a different disease for each kid who has it. It is said that no 2 kids with JM are the same, and the doctors and researchers at NIH had already figured that out. And so, while it can be scary to be in a research study, it's reassuring to know that you are helping others and that you might just help yourself as well. Dr. Ryder's knowledge and care has saved many lives over the years, and it might just have saved mine as well.
And Kristine, what advice would you have for anyone in the audience who wants to develop a research relationship with NIH?
Well, if you don't already have a contact of some kind at the NIH, I would start at the web and see which of the NIH's 27 institutes or centers, ICs, might best relate to your rare disease. You can also search for your rare disease at the NIH Genetic and Rare Disease Information Center that you heard about before this session. You can reach the specialists there at the GARD Information Center, and they also have a virtual exhibit here at the conference, so feel free to visit them at their booth. Another research that's available is the Nih Reporter, which you can find at reporter.nih.gov. You can enter your disease and find researchers studying your rare disease, as well as NIH-IC's funding research in your disease. The Office of Patient Recruitment at the NIH Clinical Center can help you with clinical trial participation. It's just a matter of reaching out to the information specialist to connect. You can also find papers that are published by researchers outside of the NIH and connect with them. We have found that the staff was very responsive at the NIH, whether or not CureJM was supporting the project. Let me add that many projects can move forward in your disease with supplemental funding. For example, even if a small supplemental grant can influence the direction of a research project, if the grant objectives make sense to the researcher. I believe that CureJM's first support of NIH was somewhere around $25,000.
And Dr. Ryder, other than grant funding, what do you think NIH researchers value most in their partnerships with nonprofits?
Well, Jim, I think it relates a lot to what you said in your opening remarks about bringing in families and finding a network of mutual support and strength in numbers. CureJM has been extremely successful in engaging families, and we were able to translate that engagement into research participation. Katherine is a great example of that. And really, her outcome and how she's done with her illness has been so heartening to see through the years. That's what makes CureJM such an important partner, even more than the research grant funding.
Well, thank you, Dr. Ryder, and thank you, Katherine, and thank you, Kristine, for being with us in this session. I hope the audience has found it informative, and we have received many questions on the Q&A. We have used up our allotted time for this particular session, but we'll get back to you all individually with your questions as they come in, and hope you have found this session to be valuable, informative, and hopefully inspiring about the kinds of activities and actions you can take with your own nonprofits, or if you're thinking of starting a nonprofit with the NIH or other research institutions as important partners. Thank you.